We are very privileged to have President of elect of Indian Society in Nephrology with us, Dr. Sanjeev Gulati. Welcome, sir. You're on mute.
Thank you and good evening, everybody. I would like to thank We Together for inviting me to share my thoughts. I think today, as you all know, is the World Kidney Day. I'm sure they've had a series of programs before. World Kidney Day is celebrated every year by the Indian Society of Nephrology, along with these nephrology societies all over the world to raise awareness of this kidney disease in the community. And this year, too, the Indian Society of Nephrology has taken a lead in doing many such events. We started since Monday, and this is, I think, another great event in our mission. The theme for this year is Kidney Health for All Bridging the Knowledge Gap, which means that we want to provide kidney health for all, but we have to bridge the knowledge gap. यानी जो gap है between the community, the patients and the doctors, we have to increase their knowledge because knowledge is power, and we have to empower everyone to educate themselves so that they can choose widely which is right, which is wrong. So over to Simran. How do we go ahead? Are there any questions, or should do I do a presentation first?
Sir, Mr. Amit will be carrying forward the session, and we warmly welcome you.
Thank you, sir. Good evening, ladies and gentlemen. It's great pleasure for me to introduce our chief guest, Dr. Sanjeev Gulati, on Baatein Kidney Ki. Welcome, sir.
Thank you.
Dr. Sanjeev Gulati is a Principal Director, Nephrology and Kidney Transplant at Fortis Group of Hospital, NCR. Also, he is President-elect of Indian Society of Nephrology. He has special expertise in managing kidney transplant and children with renal diseases. Also, he played a vital role in dialysis and transplant programs in India. He has presented papers at several international and national conferences and published more than 130 scientific papers on kidney disease. So you can share your presentation.
Right. So as I was telling you, the theme for this year is kidney health for all, bridging the knowledge gap. So in the recent years, the prevalence of kidney disease is increasing. The slides are visible now.
Yes, sir. Yes, sir. They are visible.
And yet the prevalence of kidney disease is increasing. So what we have realized is that unless and until the common man, the common person is aware of what causes kidney disease, how to prevent kidney disease, what are the methods for early diagnosis of kidney disease, we will not be successful in our goal of reducing the burden of kidney disease. India, as you know, has one of the lowest number of nephrologists to patient ratio. We are just 2,000 in the entire country of more than 800 million. So that is the endeavor today, and I will tell you about how to save it. Just a word about the kidneys. As you can see, kidneys are two fist-sized organs which are there here. They're connected by a tube called the ureter, which brings the urine to the bladder, and then through the urethra it goes out. So this is the part of the urinary system which helps in, you know, doing many functions, one of which is removal of toxins and waste products. So these are the functions of the kidneys. We all know that they clean the blood of toxins, mainly the waste products which are generated because of the food that we eat, which is broken down into, the toxin products are removed. The rest of them are used. The carbohydrates, proteins, the fats are used. In addition, they remove the excess water, which comes out as urine. Then they keep, what you all may not know is that kidneys also keep the chemicals in balance. Okay, blood has got calcium, phosphorus, sodium, potassium, magnesium. So all these chemicals are kept in balance by the kidney, which gets rid of the excess amount of the chemicals, otherwise there would be an imbalance and which would affect the functioning of the other organs. And it controls red blood pressures and red cells, and because of the chemicals, it also has effect on bones. So kidneys do much more than just removing the waste products and the excess fluid. And this is the unit of the kidney called a nephron. It's a complex one, but it's a filter, we call it, just like a tea filter. And each kidney has got about 10 lakh nephrons. Now, the kidneys are like diamonds, so they are precious. And once damaged, they can be rarely repaired. Just like a diamond, once it becomes damaged, it becomes useless. Similarly, the kidneys, once they are damaged, there's very little we can do. The kidney disease progresses. So, prevention of kidney disease is the key. So, before we go to that, let's try and understand what causes kidney disease. These are the top four causes worldwide, and in addition, in our country, kidney stones are an important cause. But diabetes, hypertension, kidney stones are essentially lifestyle diseases. So there is a lot we can do if we understand and control these diseases, and we can prevent kidney disease. For glomerulonephritis, if we diagnose it early, it is curable. And then cystic diseases are hereditary, so they are difficult diseases. Now the COVID pandemic also, drove home the importance of kidneys. And what we found was that COVID was damaging the kidney in a significant number of our patients, leading to protein leakage, loss of kidney function, and some of these patients ended up on dialysis, multi-organ failure. But a bigger concern was that chronic kidney disease patients were more prone to develop COVID infection and worsening kidney damage. Not only that, they were at 2.5 times higher risk of death than in those patients in the general population who had normal sized kidneys. So this happens because kidney disease patients have poor immunity. And when you look at dialysis patients, the risk of death was 25 to 30%. So out of 100 patients on dialysis who developed COVID, 25 to 30 did not survive, and transplant another 5% did not survive. Now, this is the different stages of kidney disease from stage 1, stage 2, stage 3, stage 4, and stage 5. Now, our Indian Society of Nephrology has got data from all over the country. It has collected data, and what we have realized is majority of these patients are coming to us in stage 4 and stage 5 kidney disease. The early stages are symptomless, silent. So that's why kidney disease is called a silent killer. But nevertheless, you need to remember it is a killer because kidney disease patients can die, and they die because of infections and they die because of heart disease. Infections we have already seen during the COVID pandemic, but even without the COVID pandemic, the infections are more common, except that we don't realize that the patient who died because of infection or developed infection had kidney disease earlier. So if we look into their case records, significant number of them who died would have weak kidneys. Similarly, heart disease is far more common in kidney patients. About 50% of all kidney patients have heart disease. So it's all the more reason to take kidney disease seriously, because kidney disease can kill you. And these, how can an average person protect oneself or protect one's kidneys? And we'll discuss this in detail. This is applicable because applicable to everyone. We call it the 7 good habits. And what are those? First and foremost, keep fit and active. Second, monitor sugars and blood pressure. Third, eat healthy and keep weight in check. Fourth, do not smoke. Fifth, do not take painkillers and antibiotics without proper prescription, or do not take any alternative therapies too, I might add. Sixth, do not ignore mild and vague symptoms. And seventh, get annual tests once you're more than 40 years. If there is family history of kidney disease, if you are overweight, if you've got high blood pressure, if you've got diabetes. And these tests are very simple and not very expensive. All these tests done together would cost just under 1,000. So blood urea nitrogen, creatinine, urine test, and an ultrasound. And what we need to do is, based on creatinine, we need to do an EGFR or estimated GFR. So first and foremost, keep fit and active. Well, this Regular exercise should be done at least 30 minutes per day. Physical activity gives a boost to the immune system, and regular breathing exercise should be done. It also, as well as yoga, it also boosts the immunity of the lung and the heart. It's good for the heart also. Now, second, we have monitor sugars and blood pressure. As I told you, diabetes is the commonest cause of chronic kidney disease, and good blood sugar control in the early stages can totally prevent chronic kidney disease. Hypertension is the second commonest cause, and it can also, good blood pressure control can prevent chronic kidney disease. And in those patients who already have kidney disease, good blood pressure control can significantly prolong the life of the kidneys. Even if your kidneys are damaged, your kidneys will last longer if your blood pressures are under good control. Next, eat healthy and keep your weight in check. This is called what we call a DASH diet. And so I think some of us, it was discussed earlier, a diet which is rich in fresh fruits and vegetables, low in salt, very important because Indians are the highest salt consumers, I think, on the continent. We cannot have our meals without char, chutney, papad, raita. So we have to, if you have to limit salt, we have to get rid of all this. Nuts, like especially almonds, walnuts, and ginger, garlic, pepper, all of them are there in abundance in the Indian kitchen. Use unsaturated fats, and we have given away our, uh, dalda and these have largely been replaced by oils, which is good. But do not take excess of unsaturated saturated fats. Make sure you take a lot of unsaturated fats. Yogurt is good, and plenty of liquid should be taken. Now, next is do not smoke because nicotine causes narrowing of blood vessels and reduces blood supply to the kidneys. It causes high blood pressure, and studies have shown that compared with non smokers, current as well as people who stopped smoking had higher levels of protein leakage in the urine and also had lesser excretion of creatinine, and there was higher serum creatinine values. And those patients who have kidney disease and are smoking, their kidneys faster progress from stage 1 to stage 5 CKD as compared to those who are either non-smokers or who have stopped smoking. Next, avoid painkillers. Avoid anti-acidity drugs like pantoprazole, esomeprazole. Avoid indiscriminate antibiotics. And last but not the least, avoid alternative therapies which are untested, unvalidated, because all the drugs that we use as kidney doctors have gone through several trials, initially in animals, then in human volunteers, then in small subgroup of patients, and then larger subgroup of patients. We call it phase 1, phase 2, phase 3, and phase 4 studies, so that we understand that what are the benefits and what are the risks, and we can monitor the side effects. And nowadays on social media, you see a lot of alternative therapies being propagated. Now, I'm not against alternative therapies, but yes, if alternative therapies are a science, then they have to go through all these four phases so that we know that what are the benefits and what are the risks that we need to monitor. So, do not ignore vague symptoms. Symptoms are non-specific in kidney disease, like feeling short of breath, getting tired, lesser appetite, because and so until you investigate all symptoms in detail, you'll not know. And kidney disease, that's why it's a silent killer. Symptoms are non-specific and late. Always consult your doctor. And during COVID, we have seen that a lot of patients said, "Oh, there was COVID. I cannot come for hospital." Well, the kidney disease doesn't stop, and now the government has legalized teleconsultation. And I personally have done more than 5,000 teleconsultations, and we have helped our patients even in distant corners who could not come because of COVID. Get annual tests if you are in the high risk category, especially of more than 40 years. And these tests, as I told you, are blood urea nitrogen creatinine, estimated GFR, which is percentage kidney function, which is calculated from these values, a urine test, and an ultrasound. Not expensive tests, and almost available every nook and corner of the country. So the take-home message is that patients with kidney disease are at high risk of COVID. We have learned that over the past years because of comorbidities. Risk is much higher in dialysis patients than in kidney transplants. And we've also shown in our research that kidney transplants can be done safely during COVID times. COVID vaccination is a must. for all and booster doses for kidney patients. And until this pandemic goes away, we should practice sanitization, masks, and social distancing. And this is my YouTube channel, The Kidney Clinic. So I know that there is a lot of unsubstantiated treatments on the social media. When I was researching, I went through this, and this has prompted me to launch this channel called The Kidney Clinic, where I have read literature, and previously I was a professor. I used to teach uh, students, and I thought that let me first teach the general population. And what I'm telling you is what is documented in scientific literature in kidney journals or from research which is I have done personally or my colleagues have done at other parts of the world. There's another site I have picked up, kidneyeducation.com. There is a free book that is available. It is available in not only in 25 Indian languages but also in international languages. Kidneyeducation.com. You can download it. So these are authentic sources where leaders from all over have participated into create this resource, and do not believe any crap that you see, and learn from this. So the best I concluded, the best and only way to save your kidney from the virus is prevent from getting infected in the first place, hoping all these precautions and stay safe and healthy. And this is my YouTube channel again, the Kidney Clinic. So if there are any questions, I would be happy to take them.
Thank you, sir, for sharing valuable information on kidney. It is really helpful for our audience. Our patients will get benefited from your YouTube channel.
Thank
During
you.
our presentation, we have a lot of questions from audience. We'll take some. We'll
Sure.
take some questions. Sir has a special expertise in managing kidney transplants and children with renal diseases. So we have some questions from the parents of kids having kidney diseases.
Yes. Can you read?
When a kid, yes, when a kid gets is detected with a kidney disease, every parent feels very like bad, or like he feels like what will happen about his my kid. He's worried about his kid. So how do you suggest like what a parent can do best to take care of his kid?
Well, first of all, I will start from the pregnancy period. Uh, a good ultrasound should be done in
What best
all
parents can do
pregnancy
to take care of their kids?
who have kidney diseases. So as I said, I will first start from preventing kidney diseases in children, and that is by a good prenatal ultrasound, where we can detect swelling in the kidneys, and we can segregate these children at birth who require detailed investigations. Hydronephrosis is a common problem in um, fetuses and in children, and this leads to urinary tract infections, kidney stones, and there are instances of kidney blockage. And if we are able to detect it early, a lot of this can be prevented. We can put them on preventive antibiotics. We can monitor them. We can treat early urine infections, and we can treat kidney damage. Another problem in common problem of children is nephrotic syndrome, and I've personally done a lot of research on nephrotic syndrome, which is published in international journals. I've presented papers at various international scientific conferences, and nephrotic syndrome is one of the most easily treatable diseases if we diagnose in time, and it is completely curable also. So, in children, what we are now advocating is that there should be regular health checkups done while they are at school. One, we can do at birth. Second, we can do one urine test at school entry time, and we can pick up those patients, children who have got some urinary problems, and refer them. And thereafter, we suggest at least one at the exit time, and if possible, every 5 years. So this is how the early kidney disease can be diagnosed in children, and we can treat them. We have patients who have chronic kidney disease in children, and for chronic kidney disease in children, let me tell you, kidney transplant is still the treatment of choice. I have experience of more than 500 kidney transplants in children, And it is very rewarding to see these patients that despite although they have had a difficult time, but the moment the transplant is done, they do so well, both academically as well as in their day-to-day life. Life is nearly back to normal. So that's as far as the kidney diseases in children are concerned.
So every parent thinks like, what will be his my child's long-term outlook after kidney transplant?
Yeah, that's a so study. Actually, even my own experience has shown that if you look at kidney transplant, children do better than adults. I have several children in whom we have done kidney transplant before they started schooling, 4 years old, 3 years old, and they've had completed their schooling. They've gone to college. Some of them whom we transplanted while in school. I remember a young girl we transplanted when she was in class 8. She cleared a class 10th and class 12th with more than 90% marks. She did her engineering, she did her master's in IIT. She's a faculty now in IIT. She's also happily married. So the only thing is, yes, they have to have a disciplined lifestyle, take regular medications. But yes, but then there is no other treatment, and dialysis is not the treatment as far as kidney transplant, chronic kidney disease in children is concerned, because the painful process, long-term outcomes are not good.
Yeah, that's great, sir. It's great to listen such a good inspirational words because many parents they are always worried about the kid, and if they hear this, they will have a hope.
Yes. No, I think there is a organization called Kidney Warriors Foundation, which is also doing a very useful work. And a lot of patients are members, and there are patient support groups that are there. So we can, I mean, people can join that and learn from each other's experiences also.
So one of the our audience has a question: what will happen? His kidney transplant in his kid has been not successful. So what are the options in this case?
Yeah, so if the kidney transplant fails, and it does occasionally, then the child has to be put back on dialysis, and we plan for another transplant. I have personally have a patient where the parents, I think he developed kidney failure very early on. The first transplant was done, I think, about 2 years of age. It didn't work. He stayed for a couple of years on dialysis, and we did a second kidney transplant. And today, that child, I mean, he's no longer a child. He's now, I think, close to 35 years old. And he's managing his father's business. He's supporting him, the entire family. So, first transplant failing is not the end of life. Life goes on.
Great, sir. In case of youngsters, they understand the symptoms. They explain what is happening with them. Whereas this is not the case with the kids. How do we identify as a parents that they have
Yes,
something?
yes, I think that's why diagnosing kidney disease in younger children is a challenge. But simple tests like urine tests at least should be done in all children. And if you find urinary abnormalities, do blood tests and an ultrasound. As I said, ultrasound and urine tests in everyone, and those which we suspect some problem, do a blood test also. I have already highlighted those tests. They are very simple tests available everywhere.
Sir, in youngsters, hypertension and diabetes are the two reasons for the kidney issue.
In elderly
Kidney
individuals, elderly,
elders.
not in
Sorry,
youngsters. In
elderly, sir.
older
Sorry.
people, hypertension is, yes, even in children, hypertension can be a sign of kidney disease. So if a young child has got high blood pressure, please get his
Mhm.
kidneys checked up. And if you have froth in the urine, if you have blood in the urine, if there is swelling all over the body, these are signs of kidney disease in children.
What could be the other reasons? Are there any
For
other reasons? Are there any other
kidney disease
reasons for the kidney diseases
in children or adults?
in children?
Okay, so let me tell you the common causes of kidney disease in children. Number one is what we call kakut. Kakut stand for congenital abnormalities of the kidneys and the urinary tract, which means that there are developmental malformations of the kidney, which happens because of imperfect development, and a lot of these can be diagnosed before birth. So that's why I said a good ultrasound is must, and that too it should be done after 18 weeks, because that's when the kidney development really starts. So good ultrasound at 18 weeks, repeated at say about 22 weeks, if can pick up a lot of kidney problems. Now, once that is there, the second commonest cause is urinary tract infections and reflux nephropathy, as we call it. Number three is diseases of the kidney filters called glomerulonephritis. Chronic glomerulonephritis is an important cause. Then at number four, we have got kidney stones, and then we have some hereditary kidney diseases called cystic kidney diseases, which tend to run in families.
Okay, thank you, sir. Sir, actually, we are flooded with the questions, but however, the time constraint,
Sure.
we cannot take all the questions. Maybe we'll connect with you some other day also.
Sure enough. Yeah, yeah. Most welcome. I think you people are doing a great job and helping us fulfill the Indian Society of Nephrology, fulfill our theme of bridging the knowledge gap so that we can provide kidney health for all. And I compliment wetogether.com care as well as the entire team at wetogether.care in our effort to, and I hope this continues, and as the
Yes,
president-elect of the Indian Society of Nephrology, I'll be looking forward to a continued partnership with organizations like you.
thank you,
Thank
sir.
you.
Thanks for the good words. This will encourage us to do more things.
Sure.
On behalf
Okay.
of wetogether.care platform, I extend really hearty vote of thanks to our chief guest, Dr. Sanjeev Gulati, who has spread time with his busiest schedule to grace the occasion. Thank you, sir. Now I hand over this to Simran.
Thank you so much, sir. We often hear like doctors are God, and we have seen that doctors have done best during this COVID time. And relating to the CKD and COVID has been like a tough journey for lots of people, and we have lots of information on our Be Together platform. So I request everybody to go on our platform and check it once. And as a token of love, sir, please accept momentum and caricature from our side.
Yeah, thank you once again for inviting me here and honoring me with this mementos. And as I said earlier to Amit, also I look forward to a continued partnership with WeTogether.care in our endeavor to reduce and control kidney diseases.
Thank you so much, sir.
Okay, bye.